Hello to all my fibromyalgia friends. Welcome to a highlight of Fibromyalgia Advocacy and Action training for our Delegates program. We will be launching a new portal in the fall of 2023 for our current Fibromyalgia Delegates, and then we will be opening it up to additional delegates by early 2024, maybe even sooner. This will be an advocacy portal where fibromyalgia patients, organizations, and groups can collaborate on advocacy-related issues. We hope to expand beyond the United States, so please let us know if you're interested in joining our Fibromyalgia Delegates program. For today's agenda, I'm going to review appropriations request and then some next steps that are happening this month in May of 2023 that we need all of the fibromyalgia patients around to rally some support around our delegates. An appropriations request is a formal proposal submitted by a government agency, department, or program to request funding for a specific project, activity, or initiative. The appropriations request typically includes a detailed explanation of the project or activity, the expected outcomes or benefits, and the estimated costs and the funding source. In the United States, appropriation requests are typically submitted to Congress by federal agencies and programs as part of the annual budget process. The appropriations committees in the House of Representatives and the Senate then review the requests and make recommendations on how much funding should be allocated to each program. Appropriation requests are important because they determine how much money the government will allocate to different programs and initiatives, and they can have a significant impact on the delivery of public services and the achievement of policy goals. So we have successfully submitted some appropriations requests to particular senators this year. And we are meeting with those Senate offices this year, both virtually and person, but we do need your help. So we are asking for our representatives to write in the appropriations request so that the National Institute of Neurological Disorders and Stroke can open up research opportunities for the accurate classification of fibromyalgia as a neurological condition. So we're asking the NIH to help us classify fibromyalgia properly, find a home for it at the NIH, open up more pathophysiology research specific to fibromyalgia. We need more research that's specific to fibromyalgia so that we can get at the pathophysiology, open up other treatment options, and potentially assign a new medical specialty or even open up training for neurologists and any other specialties that may be open to learning more about fibromyalgia moving forward. We have submitted appropriations requests for Senator Graham in South Carolina, Senator Rubio in Florida, Senator Merkley in Oregon, and then Senator Durbin in Illinois. We are looking at having additional submissions this week because we are taking meetings with Senator Baldwin from Wisconsin and Senator Britt from Alabama. So we are excited for the potential moving forward. And again, if you are in any of these states, please let us know. We could definitely use your help in rallying the senators. Now, if you don't see your state listed, don't worry. We still need your help rallying. We need all the support we can get in outreach for fibromyalgia advocacy. So this means emailing. This means calling the offices, letting them know that we need to increase our federal funding spend for research for fibromyalgia to match the prevalence. It's very low and it doesn't match the prevalence. So we need to increase fibromyalgia specific funding, and then there's a lot that you can do. To let you know, we got these states, particularly from senators that are on the Appropriations Committee for the Labor, Health, and Human Services, Education, and related agencies. It's a mouthful. I will add a link. So this is for the 2023 year. And we're building up our relationships with our senators. So we're looking for our champions. We're looking for our dear colleague letters as we continue to move forward. And we are excited to have our fibromyalgia delegates joining us this year. And if you are interested in this type of program, please reach out and sign up. Registration for virtual Hill Days is closed for 2023 of May, but we are going to be returning to DC in person June, July, and then early 2024. So get ready if you are interested in joining us in person in Washington, DC at Capitol Hill. We needed your help, and we will be returning early in 2024. We have other ideas for people that cannot make the trip to DC, because there's a lot that you can do in your own home state, at home, virtually. So we will have more information as part of our training moving forward. Please, please definitely take action when it comes to fibromyalgia advocacy. We need everyone involved. We need to take action to support advocacy events. A lot of you ask, how can we get more funding for research? How can we get better treatments? Push it forward. How can we get our medical providers trained? This is part of the piece of that. So we have to be vocal. We have to let people know, and our representatives know, that fibromyalgia needs more attention, and it comes from all of you, the constituents. So we'll get into more training shortly. Thank you, everyone. Again, please support Fibromyalgia Advocacy in Action. This is a collective collaboration of other patient organizations and groups in fibromyalgia. We're all coming together. We're working together to complete the Fibromyalgia Advocacy in Action. Thank you so much. I am Melissa Talwar. I am the Executive Director of the Support Fibromyalgia Network.